No wonder lawyer is the last laugh, whether it was intentional or it just happened by default. But no wonder when we talk of regulations in eHealth, I think lawyer would have last laugh. And that reminds me a very famous song of Amitabh Bachchan movie Lawaris. जिसका कोई नहीं उसका खुदा है यारो, मैं नहीं कहता किताबें कहती है यारो. And that is very relevant when it comes to e-health laws in India, because there is no specific law that governs e-health in India. And when there is no specific law, it becomes interpretational issues. And on a very lighter note, जिसके बहुत बाप होते हैं उसके बहुत problem होते हैं. That's what I think the e-health is, and that is what I think I would cover what exactly is there, but I'm not going to talk only about the what. I think I'll talk a little bit about how also, how to navigate through. And before that, I think I don't want to spend much time. Everybody knows what is e-health. So healthcare services provided over electronic platform, but the buzzword is digital. But when it comes to law and when it comes to court, the electronic and digital has different connotations of interpretations. Be careful there. So when you talk of what regulations are there in India, there are many, there are plenty, and there are good, bad, and uglies of them. And when you talk of law, let me talk of who are the stakeholders. And what I'm going to speak is about last 1.5 years, and Dr. Ganpati knows that this particular sector, e-health, started with telemedicine. Again, all enzymes are proteins, but all proteins are not enzymes. So every telemedicine is e-health, but every health is not telemedicine. Remember that. That again is a very important clarity we need to have from law perspective. So these are broadly what we have seen are the stakeholders in our experience, right from the user, the technology service providers, patient, hospitals, paramedic, ancillary service providers. These are the all people who play a role. And that is where, and we have struggled a lot, because sometimes you have an app where somebody comes just as a user, he may not be a patient. But user may become a patient, then the issue starts. And the most important stakeholder, according to me, which I intentionally kept, is doctor. How many doctors are sitting in the audience? Oh, majority. And honestly speaking, this is what I remembered from my 14 years of surgery and 14 years of law, and last 2 years when we started working on such thing. That is why I thought, let me put ... because stakeholders will keep on increasing. So what I'm going to cover is how exactly the laws govern, and as I mentioned, there's a plethora of regulations in India. So broadly, I think 4 things I see in eHealth. One is providing access to doctors, providing drugs to doctors online, to patients, consultation by doctors, and providing technology platforms. So broadly, I have not included all small things, but these are the 4 areas which I see eHealth services are really involved. And that is where let's take of access to doctors. We have Practos, we have Portias, we have Liberates, we have Zoctors, Mera Doctor, My Doctor, so many of them in India. But the biggest concern where law will come into picture would be the all access health data. And then that is where I think we discussed, and just quickly going to touch upon that data in India, the medical record is considered to be, as of today, sensitive personal information in the law. And when you deal with sensitive personal, there are so many ifs and buts attached. Before I really go on to law, there is not a single law in India which will stop you practicing e-health. You just have to navigate through and comply with them. There is another very dangerous onerous act called Clinical Establishment Act, enacted by few states, that the doctor who is providing, doctor includes hospitals also, those hospitals who have a subsidiary doing telemedicine service or e-health services, so it becomes a company law issue, becomes an entity, becomes a setup, then clinical establishment Act becomes a relevant thing. Recently, we really banged our heads because GST also has come into picture, where technology service providers fall under the establishment. Whether they get GST exemption or not is a very big issue. I don't want to touch upon that. Information Technology Act and local acts which give them permission to carry out healthcare services play a role. IT Act is very relevant when it comes to data. We do not have HIPAA type of law. One law is coming up very soon. Hopefully, the talak doesn't take away much time in the parliament. Then there are some 17 odd healthcare bills somewhere sitting somewhere. I don't know where, for last many years, and that is why things keep on changing. But today we have data privacy rules under Information Technology Act, where certain specific requirements are there that we will discuss. When it comes to online drugs, again, e-prescription in pharmacy is a big issue. How many, of course, most of them are doctors. Most of you talk to your colleagues and have advice on telephone or WhatsApp, take this, which possibly under law, under Drugs and Cosmetic Act, pharmacy regulations, and there are various court orders like Muhammad Ishfaq and Martin, is not permitted under law. Drugs and Cosmetic Act, Rule 65.11.3 has a specific thing that drug cannot be dispensed unless registered pharmacist at a registered pharmacy sees the physical copy of the original prescription by a registered medical practitioner having his registration number on the prescription. After dispensing, puts the stamp of the date and time of dispensing. This is what law says. Like in India, sab kuch chalta hai. But when you do business, be careful of this. Consultation by doctor, most important and most neglected is Medical Council of India. I never bothered to read Code of Conduct of Medical MCI for 14 years when I was a law, and I read it for the first time when I became a lawyer. Public confession from the podium. Today, doctors don't bother for the MCI code. It's a fact, I know it. But the most important thing I think doctors need to be worried on eHealth when it comes to law is the liability issues. There are so many, and what covers? Your Medical Council Act, there are local acts of that particular area where you are practicing. Medical Council is a very big issue because today, doctor registered with one state medical council cannot advise patients sitting outside that state, which is a big issue. Recently, there is a change. We worked a lot on the National Telemedicine License. There's a very big positive that has come. Now it is permissible, but you need to get that clarification there. Technology platforms have specific services and allied services. We have seen so many people having multiple things. The biggest, most important law, of course, there are certain requirements on OSP, which is other service provider if you have a telecom, if you're on a mobile app. But the most important contract law is going to be very important for all technology service providers, because what you do is you enter into contract with multiple. You have hospital one side, you have ambulance services other side, you have a corporate company somewhere. You create a small room in that, their setup in their offices and provide services where paramedic is sitting. That is where contract is going to decide about the liabilities. Quickly on that, what are the concerns? I'll go very fast. Medical advice across state borders, I discussed, were a big issue. Recently, a clarity has come that doctor registered with one medical council can practice across India, but not yet implemented. That is one thing we discussed in the last conference. Prescription over internet, I discussed. Rule 65 of drugs and cosmetics will become a big issue. Health data protection, again, unless... So what happens that when you capture data, whatever information that is collected over eHealth services, if they are identifiable and non-anonymized, we call it, then there is a problem. Problem in the sense that you need to comply. You need to have informed consent, you need to have privacy policy, you need to have so many things which you need to carry out to comply with them. Fortunately, as Professor Rail mentioned, electronic health, I can mention that, no? Yeah, Electronic Healthcare Data Standardization, Privacy and Confidentiality Act of India, it was 2017, but could be 2018 is coming. I am very happy to share we three were actively involved in more than 10-15 minutes. This law is better than HIPAA, that I can tell you for sure. which has clarified a lot of things, and once it comes, it is going to resolve lots of issues in that. Liability of telemedicine over telemedicine eHealth, be careful. That documentation is important. Don't neglect that. Nothing is going to happen to you, and record everything. There are various things that whenever you are advising the doctor sitting here, majority, clarify what you are doing, what you are not going to do, what are the limitations. That is going to play important role. General regulatory compliance, I don't want to go into that. These are the certain consents you require under unsolicited commercial communication, telecom communication to consumers. All those compliances are required. That doesn't make you stop business, but just watch out. Watch out of few things. Establish patient identity, consultant identity, potential risks, consequences, and also give a disclaimer that audiovisual is not everything. There are certain limitations to that, whether it is doctor, hospital, technology service provider. This is very important. Patient must provide you a clear written instructions as to who to call in case problem happens. Take that first from the patient. Statement on satisfaction after each teleconsult. This is going to give you a significant immunity against potential liability, and of course a consent about teleconsult. Doctor, same thing. Explain him. Have number of the person who should have. Most important, doctor must clarify that there are certain limitations, need is not adequate sometimes. And the last and most important thing is, doctor has a right to be selective. There are various case laws. There is a Bolam test, there is Muhammad Ishfaq, there is Jacob Matthews, so many case laws in India which are favoring doctors, which broadly says that if your negligence is just out of sheer intentional thing, there's a mens rea. But if you have taken other person's consultation or opinion, you are possibly kind of immune against that. And this is what I think, I'll just end with things. What I'm going to see is a huge convergence of IoT and AI and healthcare, and this is going to bring lots and lots and lots of issues. And that's why, I love this statement that using digital tools to reach patient is no longer a question of if, it's a question of how, and it's a matter of now. And that is what I want to try to say, that my favorite line, I keep on speaking that at the end of every tunnel there is a light. A lot of positives have happened. Electronic HIPAA type law is coming. Most important, very soon you are going to have online prescriptions being allowed, online consultations being allowed, and lots of positive things are happening. But as I said, at the end of every tunnel there is a light. But you have to be careful that it could be of a coming vehicle. So walk carefully. And when you want to walk carefully while practicing eHealth, you need to have something now. And sir, we need to have a Telemedicine Act of India which covers this. I request various forums, Dr. Ganpati and his colleagues are there. It's a high time that India has a Telemedicine Act of India which will give comfort to each and everyone. Thank you very much.